where the muscle originates, it's called as lateral epicondylitis or tennis elbow. So the patient will be having pain here. This is the lateral epicondyle. So here the patient has pain in the tennis elbow. So now we are giving a taping to reduce the muscular forces. The taping always will not arrest the movement. Taping will help you to do the functional movement. That's why we are using the taping technique, and it will reduce the muscular force because the tape will take up the muscular force and you can make the patient to do the activity. Okay. So in the taping we have anchors, strips. I told you for tennis elbow, initially you will put one anchor strips just below the elbow here. One anchor strip we will put, and
what's that area, doctor?
This is below the elbow.
Okay.
Below the elbow. Next, at the level of the below the head of the metacarpals. Okay. First two anchors. Then what we will do, the extensor digitorum tendon. How many extensor do we have? This 4 major extensor digitorum tendon. 4. Yes. Arba. 1, 2, 3, 4. So we should check the length, approximate length, and we should make, see, this is the size. So we should make 4 sized tape for this.
When you remove talik?
Huh?
When you remove talik?
When you remove the taping, after maximum it should be for 8 hours, not more than that.
8 hours?
8 hours. Then you have to change the taping.
Change.
Yeah, always.
If you don't change?
If you not change, what happen? All the dirt, because from our body, oil, dirt, everything, and that will irritate the skin. So take it, clean the skin again. Okay. So you know, before the hair should not be there, it is a contraindication.
Yes.
You should remove the hair, lot of things for giving, and you should clean the part, everything, you know, the theory part and all.
Yeah.
So now see, one by one, from this area, see, exactly from this anchor, pull it and paste it in this anchor. Okay, 1. Same way for each extensor digitorum tendon. Again,
This is the middle.
from each finger, here, 2. Like this, 2. Again, 1 more. 3. And again, take it, 4. Okay, so 4. Why this? See, this is in the direction of your extensor tendon. So what happened? The extensor force will be distributed to this thing. That is the idea. Understand?
Yes.
Because if more muscle work, what happened? The muscle is attached here and the strain will be more. So I am taking up some of the force from the muscle by this tape. That is the main advantage. So now I have pasted this. Now again, to avoid, because this should be supported. So for that, what I will do, I will put again a
double anchor.
Double anchor. Yeah. So to make that should not come out, so I am putting again, see, fix it, and then I am putting. So first step is over. Okay. Now next thing what I should do, for that, you remember in tennis elbow I told you we will do Cosen's test. Cosen's test, you remember? Extension and radial deviation, because you have the extensor muscle, extensor carpi, radialis, because radial deviation. So you have more of radial deviation should be arrested, because that will also give strain to the patient. So for that, another thing is what we will do is, Same way, take the double the length of the forearm. Double the length of the forearm. That will be last stage of it. See, next is, now what we will do, keep this, see, in the middle, we'll keep like this, okay, and now we will take the force to medially like this, cross, attach it like this, more force, pull, okay, now stabilize this, again, pull, and attach to this area. So this is to avoid the radial and ulnar deviation, cross.
So we try to keep it in the middle.
In the middle. We are not avoiding the radial, too much of radial or ulnar deviation. See, we are not arresting the movement, very important. We are not arresting the movement. We are reducing the muscular force, because now he can do radial and ulnar deviation. But the muscle force is taken up by this tail.
In the previous classes, you said you much do.
In this pulling, see, in this what we are doing, we are pulling and we are avoiding the radial deviation and then our putting. That is, excess of movement will not be, we will give a force and we will pull. But
Unnecessary
important, movement should not be arrested. In that class I told you, you have to arrest the movement.
No.
No, movement should not be arrested. Pull this and pull, colors. Okay,
Unnecessary movement.
unnecessary movements.
Okay.
Understand? So first step, put 2 anchors. Second step, put 5 strips. Third step, cross. Clear? This is a simple method of taping. For still we can do a more another way of taping. I will tell you, for tennis elbow it's a many types. One, you can put only taping here under the condyle, only taping here. What is the advantage? You can see some people, players, they wear some band here. Some people they can put tape. What is the advantage? Only here.
Because the origin, all muscle.
Because if you are giving a reinforcing support here, what happens? Excuse me. All the force will be distributed here. So that force will not go to that joint. So the strain will be less. That is the advantage. Understood?
Yes.
First step, tennis elbow. First, 2 anchor strips. Divide 4 pieces. Put the 4 pieces here. Third step, take a one long strip and cross. In the cross, make sure that you are controlling the radial deviation. Very important. Okay. Pull that and put. One side you can put slightly. For radial deviation, pull and put it tight. That's all. Clear?
Clear.
This is first for tennis elbow. Next,